orientation terms. So we have distal and then proximal. So distal means towards the tip, and then proximal means towards the center of the body. And the leg, that looks like proximal in the center of the body, and then distal out towards the foot, out towards the limb, right? So, and remember, everything is relative. So the knee is proximal to the foot is distal to the knee. The knee is distal to the hip joint is proximal to the knee joint. And then we have medial and lateral. So medial refers to towards the midline, right? The midline is always from like the nose, between the eyes, down through the chin, the throat, the belly button, pubic symphysis, right? That's the midline. On the back, the midline is the spine. So we have medial toward the midline, and then lateral. So the liver and the spleen and pancreas are lateral to the stomach, or lateral to the jejunum, the top of the small intestine, right? Or lateral to the midline. The jejunum, or top of the small intestine, is more medial than the liver, more medial than the pancreas and spleen. Let's see, the pecs are lateral to the breastbone. The breastbone is medial to the pecs. If you're looking at the body, at the limbs, and you're looking at the limbs in anatomical position, then the thumb would be more lateral than the pinky, and the pinky is more medial than the thumb. Although there's a specific term for the hand that we like to use, and that's radial and ulnar. Radial and ulnar. So you guys be sure to be speaking these on your own. As I'm saying these, you should be saying radial and ulnar, medial and lateral, and also touch. So touch where I touch, move the way that I move, and then use the terms that I'm using. That'll really help you a lot. It'll help your brain use more than one area, which will force an additional area, the association area of your cortex, to work to put it together. And then when you go to sleep tonight, your brain literally will start organizing it in a way that's a little bit higher than if you had just read it on a piece of paper or watched me do it. All right, if there are any questions, please let me know. Okay, and then in the back, the spine goes right up the back and the sacrum. So this is more medial and this is more lateral. So if you're looking at like the vertebrae have these points on them. That's the spinous process, and that's kind of how we palpate to feel the backbone. So you can feel the spinous process. That's the most medial. It's right on the center line of all the features. And then on the sides of the vertebrae are the transverse processes, right? So these transverse processes are lateral relative to the spinous process, and the spinal erector group, the longissimus thoracis, and all those muscles, those are all lateral to the spine. The quadratus lumborum muscles are even further lateral to the spinal erector group. The spinal erector group are medial to the quadratus lumborum. Let's see what else. Okay, we have anterior and posterior. So anterior is the front, posterior is the back. It's also called ventral and dorsal. Remember that we always look at the body from the front. This is the front, from the anatomical point of view, right? Anatomically neutral. So this is always anterior. The whole front of the body is anterior. The whole back of the body is posterior. Again, with the arm and the hand, it can be a little confusing because this is the anatomically neutral position. So then this is the ventral surface, and this is the dorsal surface, or the posterior surface, and the anterior surface. The term specific for the palm is volar, V like Victor, O-L-A-R, volar, and it's also we sometimes say palmar. For the foot, there's also unique terms. So for the foot, it's plantar, and then dorsal. Both the foot and the hand use dorsal for the back or the posterior aspect. So this is dorsal and this is plantar, right? So this is plantar flexion and then dorsal flexion. Superior and inferior. I think we actually may have done superior and inferior already. I don't know if we did, but anyway, the sternum is The manubrium is superior to the xiphoid process. The xiphoid process is inferior to the sternum. You know, the clavicle is superior to the rib cage. The rib cage is inferior to the clavicle. If you're looking at the hand, this would be the, actually, I prefer that you use the terms proximal and distal for the limbs, although technically this would be more superior than the tip of the finger. And this would be more superior, the elbow would be more superior than the hand, but I almost always would say elbow is proximal to the wrist is distal to the elbow. I remember one of the practice questions, keep in mind practice questions on all these, I think I have 4 now, maybe 5 subscriptions to review all these practice questions, and keep in mind that they're all somebody's opinion about, you know, what's going to be on the exam. And one of the practice questions was, you see a client who has a pain in their upper arm. So this is the upper arm, this is the lower arm, upper arm and lower arm, upper leg and lower leg, right? Lower limb and upper limb, upper arm, lower arm. So you see a client who has pain in the upper arm, and it is about, you know, an inch down below the attachment of the deltoid muscle. Is this point proximal to the shoulder joint or distal to the shoulder joint, right? It doesn't say, is it inferior or superior to the shoulder joint? They use the terms proximal and distal. And I think that's going to be pretty consistent. Okay, superior and inferior. Hand is volar and distal. Volar also equals palmar. Plantar, I'm just changing something in the notes. I have volar equals plantar. I have it written volar equals palmar, comma, plantar. Plantar and volar are not the same. So, so the bottom of the foot is plantar. Volar equals palmar. Yeah. Hand only. Foot only. Okay, the planes. So the frontal plane or the coronal plane goes this way. Remember, if you follow if your arms follow the coronal plane all the way up, you end up at the corona, the crown of the head, right? So I like to remember it that way. So it's the coronal plane, which contains abduction and adduction. Please say those along with me and be moving your limbs. Abduction. Yeah, abduction. And then adduction. That's why, you know, that's why you have to say AB and AD, because there's going to be a point where you're not clear. And the only way to be clear is to break it down like that. Abduction and adduction. And then for the head and neck, it's side flexion or lateral flexion in the frontal or coronal plane. Also side flexion through the trunk or through the spine. And then for the lower body in the frontal plane, doing AB and adduction, let's switch to the sagittal plane. So the sagittal plane is going this way, right? So that's hip flexion and then hip extension. Also flexion and extension of the knee. Sagittal plane would also be plantar flexion and dorsiflexion. Or the hip joint, a good old deadlift or hip hinge would be sagittal plane movement. And then through the spine, sagittal plane movement would look like flexion of the spine, extension of the spine. For the shoulder, it's flexion of the shoulder and extension of the shoulder. Remember that this is neutral. For the shoulder, this is neutral. So even though I'm, and right now I'm flexing, right? And if I start to bring my arm back towards neutral, I'm coming out of flexion, moving towards extension. But I also like to call this extension, because if I call this, you know, reverse flexion or something like that, it doesn't tell me specifically what muscles are involved. If I know that I'm moving my arm down this way, I know that these muscles in the front are moving eccentrically and these muscles in the back are moving concentrically, because that's what happens in extension. So get used to thinking about the arm somewhere in the arc of flexion. moving towards extension or starting to move into extension as you move down toward neutral, even though you're not from neutral into the extension zone yet, because it'll clarify which muscles are moving in what way. Okay, and then flexion and extension of the neck would look like this. Also flexion and extension of the elbow, flexion and extension of the wrist. So that's the frontal plane and the sagittal plane. Next is the horizontal and the transverse planes, right? So horizontal or transverse plane looks like this at the neck. So that's rotation. It's horizontal abduction, horizontal adduction at the shoulder, or horizontal cross flexion. It's called cross flexion. It's also called through the spine. That would look like rotation through any segment of the spine. Segment is, you know, L5, L4, L3, L2, etc. on up to C2, C1. Those are all segments. So any segment of the spine turning this way would be rotation. I also consider external rotation and internal rotation to be transverse plane movements. I don't think they're going to ask you that. I think it's interesting to think about, and that's it. Okay, so that's, believe it or not, that's it for the planes. I hope you guys were moving through all those. People miss, the reason I say, hey, believe it or not, we're all done with the planes, is because people miss a lot of questions about the planes. So I hope that that's not you. All right, joint movements. We're going to start with the more complex ones and work our way back up the list. We're not going to go through the whole list today. So circumduction. Circumduction involves moving the distal end, the end all the way out away from the trunk, the distal end, in a wide circle, and moving the base of the circle at a point. So the base of the circle is focused at an axis, moving around the center of the axis, and then the distal end is moving around in a circle. And this is my guy whose movements are always all natural. And if you want to see, you know, the proper natural relaxed way to move, look at your dog, look at your cat, look at how an animal moves. All right, so circumduction, right? And recall that circumduction can happen at many joints in the body. It's common in the shoulder, but it can be done in the wrist. It also can be done in the head, where the vertex of the head is the stylus or the end of the pencil, and the base of the neck is the eraser, right? Circumduction, technically speaking, oh wait, let me show you the foot first. Circumduction can be performed through the hip joint, where the foot is making a wide circle. It can be performed through the ankle, right? Circumduction also could be performed through the torso or through any segment of the spine, right? All right, and then diagonal abduction, diagonal abduction. The shoulder is a pretty unique joint, so you have to think like pretty carefully about how the shoulder moves. So diagonal, horizontal, right? So diagonal abduction, diagonal adduction, right? And then we already covered diagonal abduction, diagonal adduction. All right, horizontal abduction, adduction, lateral flexion, right? This trips up some people sometimes. This is lateral flexion. This also would be lateral flexion through the trunk. All right, radial and ulnar deviation. Remember, always look at the body from anatomical position. And then once you've got that clear in your mind, you can transpose to a different position if you need or you want to. So radial deviation, deviating the wrist towards the radius bone, deviating the wrist towards the ulnar bone, right? Ulnar deviation, radial deviation. It's not lateral flexion, medial flexion, or medial flexion, lateral flexion. It's not. No, it's ulnar and radial. Medial and lateral rotation happens through this bone here in this hip socket. And it looks like this: lateral rotation and then medial rotation. If I stand up straight, it looks like lateral rotation, medial rotation, lateral and medial. It's also called external rotation and internal rotation. A really effective way, or a really clear way to understand which way your leg is turning, is to look at the bone closest to the joint. and to draw arrows on it. So in the leg, that's the femur, right? So if I rotate my knee outward, if I'm doing external rotation and I draw arrows on the thigh, the arrow should be pointing this way, externally, laterally, away from the midline. Here's my midline. Here's the midline. And I'm rotating external. Now I'm rotating internally. The arrow is pointing this way. So that's internal rotation. And internal rotation is going to be, because it's named for the movement of this bone from the hip. Internal rotation is going to be internal and external rotation, whether I'm standing, whether my knee is bent, whether the leg is floating, whether the hip joint is flexed. That's external and internal. Whether the hip joint is extended. This is internal, external. External, internal, right? All the same, whether I'm laying down, whether I'm standing up, any position, as long as the movement is coming from the joint closest to the torso. So that's the hip joint and the shoulder joint, the hip joint and the shoulder joint. It's still going to be called internal or external rotation. We're looking at that bone that comes from that most proximal joint. We're looking at that bone as an axis, right? So draw a line from my shoulder joint out through my elbow. So you're seeing the humerus, the femur in the lower body, the humerus in the upper limb. And this is an axis. See the rotation of the axis, right? Just like the axis in a just like any other axis, just like the axis in a car or whatever. And you draw the arrows, right? The arrows pointing outward, the humerus is rotating externally, the arrow is pointing inward, the humerus is rotating internally. Okay, I think you guys get the idea. It would be really worth it for you to just go like this whenever you can, and then change positions with your elbows and get used to saying external, internal, and then change position at the shoulder, right? And then change position at the elbow again, just to get used to saying internal, external, right? So that you understand how those are moving. One more, that's supination and pronation. Supination and pronation. Let's see, what else are we going to look at? Okay, let's do a little bit of concentric, eccentric, and then we're going to move on to anatomy and physiology. We're going to look at the cardiovascular system today, and I think the muscular system. So, concentric and eccentric. We did the forearm flexors, forearm extensors, biceps and triceps last time. So now let's do the traps and the lats. So the lats, as we saw last time, the lats are the ones that depress the shoulder blade. They pull the shoulder blades down. They also, I believe that they internally rotate. Yeah, they internally rotate the arm bone a little bit. But we're interested in the shoulder blade depression today. And the shoulder blade elevation is accomplished by the upper trapezius muscle. The upper trap has 3 sections, recall. So we're talking about the upper trap and the latissimus dorsi. So if I shrug my shoulders, what kind of contraction is that? I'm sorry, let me back up. When a muscle shortens, when my upper trap shortens, that contraction is named concentric, because it is shortening, or it's moving with the fibers, or because the fibers are moving the bones together, or moving the bones in the direction that they are designed to move. When I lengthen, my upper trap is still contracted. If I have a weight in my hands and I'm lowering my hands down, my upper trap is still contracting, but it's eccentric. So when you lengthen, that's eccentric. Shortening is concentric, lengthening is eccentric. And you have to be really clear about what's lengthening and what's shortening. Con, C-O-N, here's your medical terminology. Con, C-O-N means with, ek, E-C, means against or away from. So if I'm shrugging my shoulders, what kind of, unmute yourselves, what kind of contraction is happening in the upper trap? Is it concentric or eccentric?
Concentric.
That's right. And what kind of contraction is happening in the latissimus dorsi? Concentric or eccentric?
Eccentric.
That's right. Which one is the prime mover for the shoulder shrug? The trap or the lat?
The trap.
Yes. And okay. And is that Khalees speaking?
Yes.
Okay. Good job, Khalees. Now let someone else speak. So not let someone else speak, but everybody take turns. Everybody be sure to jump in. Don't let one person steal the show. Okay, now, so we did up there. Okay, so if I'm extending my neck, where's the concentric contraction happening? In the back of the neck or in the front of the neck? Where's the concentric? Where are the muscles shortening right now?
In the back of the neck,
There you go, there you go. And where are they lengthening?
in the front,
That's right. So in neck extension, what contraction is happening where? Rosie?
extension. I want to say latissimus dorsi, but I'm
No, no, you can just say like the back of the neck because
back of the neck.
yeah, well, because we don't know all of these muscles. But
Okay,
we'll review them again. So in the back of the neck, you have what? Concentric or eccentric?
concentric,
That's right. And in the front, you have,
Eccentric.
eccentric,
that's right. And which one is the agonist and which is the antagonist in neck extension?
the concentric, the one that's working, the back.
That's right. Is the concentric one in the back, is that the agonist or the antagonist?
That's the agonist.
That's right. Very good. Very good. Okay.
So that
Hmm?
is the one lengthening.
The one lengthening is in the front. If we're doing neck extension, right? So the front is lengthening right now and the back is shortening. So you could say
So the back would be the antagonist.
the front would be the antagonist. Yes.
Yes.
Okay.
Question? All good? Okay, so then in the ventral surface, you have the abdominal muscles, and then you have, let's say, the spinal erector group. Okay, so if I flex through the spine, it's the flexors that are doing the what contraction? Concentric or eccentric? Yeah, the abdominals.
Concentric.
Concentric, that's right. And the eccentric contraction is happening in the spinal
The
erector.
back.
In the extensors, yes, that's right. If I extend, the opposite happens. So if I'm extending, which one is the agonist, the extensors or the abdominals?
Extensors.
The extensors are the agonist. The psoas and the iliopsoas. We'll look at an anatomical drawing of those in a moment. But the psoas begins on either side of the lumbar spine, up around the diaphragm, and the fibers come down, and deep inside they come down, and then they start to come out, and they join with the fibers of this other muscle that's inside of the ilium called the iliacus, and they form this insertion point here, the iliopsoas. It's actually considered a third muscle: iliopsoas, iliacus, psoas. And the psoas, the iliacus, and the iliopsoas, they function very strongly in flexion. The psoas muscle also does hip flexion and some external rotation. However, its main function for the test especially is flexion. So it's a popular thing to ask on test questions. If someone is kicking a ball to the front, or if someone is squatting down, for example, which muscles are firing in the front? And they'll name them for you, right? So they'll say biceps femoris, which would be correct, right? Psoas, or they may say iliopsoas. Don't get thrown by that. Iliopsoas, right, in the front, or they may say biceps femoris, which is in the back there, in the front, and then iliopsoas in the front. Try to swap the back for the front. So iliopsoas is definitely a term that you want to learn. So if I'm kicking a ball to the front or raising my leg to the front, by the way, this is hip what? Hip flexion or extension?
Hip flexion.
Hip flexion. That's right. Very good. So where's the concentric contraction? Is it in the front or in the back?
In the back.
front.
The concentric contraction, is it in the front or in the back?
In the back.
The front.
Rosie, it's in the front.
Front. Okay.
It's in the front because these muscles are shortening. If you're sitting down,
Yeah.
if you're sitting down right now and you just go like this, you can feel these muscles contracting without touching them or anything. You can feel them contracting, right? So this is the shortening. So this is concentric. It helps to think about the surface of the body, right? So when the question says the person is kicking to the front, think about the front closing, the front closing, the front closing. This is shortening. This must be a concentric contraction in the front. Muscles in the back have to eccentrically contract or relax in order to allow the front to contract concentrically. And the muscles in the front that contract concentrically, those are the iliopsoas, rectus femoris, sometimes called the hip flexor, the thigh muscles, right? And the ones that are contracting in the back, those are, just humor me, eccentric or concentric?
Eccentric.
That's right, eccentric. And those are, can you name some of them? How about the back of the leg? Can you name a couple of them in the back of the leg?
Hamstring.
Yeah, hamstring is kind of like a nickname for four muscles. I'm sorry, for four muscles, there's three names, right? There's the bi, just like you have the bi here, a two-headed muscle here. There's the bi here, except it's not biceps brachii in the leg, it's biceps femoris or femur. So it's biceps femoris. And then on the inside, the furthest medial hamstring group, do you guys know what those are called? Those are called the semimembranosus, semitendinosus, and an easy nickname for them is the semis or the semicisters. Okay, let me switch the view. And then we're going to go over some, we're going to go over some muscles. So part of the, my job is to get you ready for the MBLEx, right? Part of being able to do well on the MBLEx is seeing words, terminology, and knowing exactly where they are in the body, right? And that aspect of location, of being able to visualize it in your mind, like being able to go like this and feel your hip flexor contracting, being able to, move like that and to feel a muscle in the back of the shoulder blade contracting. Hearing someone say semimembranosus, semitendinosus, and not freaking out, oh my God, I don't know where that is. That's a skill that takes practice.
So are both of those on the hamstring?
What's that?
Are those two muscles you just named on the back of the leg?
Yes, we're going to look at them right now. So you have the semitendinosus, semimembranosus, and then the biceps femoris. What's this structure here? Okay, what is this big bony structure here? The whole thing.
The pelvis.
The pelvis.
The pelvis.
The pelvis. So right in the center, this must
It's the
be
sacrum.
this is sacrum. That's right. And what's down at the bottom of the sacrum?
The coccyx.
The coccyx.
Yeah.
That's right. What's the upper half of the pelvis called? This bone? Is it the ilium or the ischium?
Ilium.
It's the ilium, yes, with the posterior superior iliac spine and the anterior superior iliac spine, and also the anterior inferior iliac spine. But anyway, ilium and then ischium. Ischial tuberosities, sit bones, the bones that, protrude and stick into the chair when you sit down. Ischial tuberosity. So above the ischial tuberosity, or on the ischial tuberosity, there are tendinous attachments for the hamstrings. So they act on the pelvis and the leg. They attach on the humerus, they attach on the tibia and the fibula. And they are named the biceps femoris, femur, femoris, biceps for two-headed muscle. The long head attaches to the pelvis. The short head attaches to the femur. So you can tell that this muscle serves mainly to flex this joint right here, the knee joint. Can you guys envision that? This end is the origin. It's not going to move that much, but this bone has a joint next to it. It's going to move a lot. So
Origins, how you tell the difference between origins and attachments is the origins typically moving?
The origin is typically not moving. The origin is typically the more stable of the two.
Okay.
The more stable of the two, yes. And I'll continue to point out origins and insertions. to you. So, feel free to ask at any time. So here's the origin for the biceps femoris up here and here on the femur. And then here's the insertion for the biceps femoris. And here's the origin for the semitendinosus, semimembranosus, which are on the medial side. So if you can see the sacrum, the midline is here. And you know that these muscles are more medial and these muscles are more lateral. And that should tell you that these are the biceps femoris. The biceps femoris are the lateral ones. The semis are the medial ones. Semitendinosus, semimembranosus. I don't know why they named them that way. Someone thought that this had strongly resembled a tendinous fibers. Maybe there's more tendinous fibers in one. Someone thought that the membranosus resembled a membrane. Muscles are often named after their shape, how they move, their size, like magnus, minimus, longus, brevis. So tendinosus and membranosus. Okay, what they give you on this page is Gray's Anatomy, which is good, but not great. Okay, so let's move on. I don't want to get into too many specifics about those muscles. So those are the hamstring muscles. And then if we look at the, let's type in hip flexor muscles. And you see, if you type in hip flexor, Google says it's the iliacus, the psoas, the pectineus, rectus femoris, and sartorius. So we will look at the sartorius, and we may or may not look at the pectineus. We're definitely going to look at the other four: the rectus femoris, the psoas, the iliacus, and the iliopsoas. Again, Physiopedia. So here you have the spine. Here's the sacrum. Here's our friend, the sacrum. So this cut here must be right down the midline. Here's the floating rib, 12th rib. And here's the ilium, crest of the ilium, right? Iliacus is the name of the muscle on the inside of the ilium, They don't show the attachment, but the attachment, the insertion is on the femur down here, right? So here's the leg bone. The femur is under all the muscles, and the fibers of the iliacus, their origin is inside the ilium, inside the hip, inside the pelvis. That's not going anywhere. And they insert down on the leg. So the femur actually moves, it flexes when this muscle contracts. Also for the psoas also originates along the spine and inserts on the femur. The psoas can move the spine quite a lot, but I believe that the insertion is on the femur. And the fibers down there are often referred to as the iliopsoas. And this is a term that you very well may see. So if you look at, iliopsoas and the iliopsoas muscle and its frequently overlooked syndrome. I'll give you a couple hints clinically, which you're not going to be tested on, but if someone has hip flexor pain, or lower back pain that is on one side of the spine, going the whole length of the lumbar spine from this side is not loading, from, for example, L1 to L5, from L1 to L5, and hip flexor pain on one side, it's likely the psoas muscle. It's very likely the psoas muscle. Also, other symptoms can accompany psoas or iliopsoas symptoms. And those symptoms can have to do often with their proximity to the digestive organs or their proximity to the diaphragm. So people sometimes with tight psoas muscle can sometimes feel, because the diaphragm attaches up here, they sometimes can feel difficulty breathing, taking a deep breath, and they sometimes can feel nausea. I think because the diaphragm is probably spasming a little bit due to the iliopsoas being so tight. But you can see the psoas muscle originating on the spine, coming down and attaching onto the femur. Notice it's on a little bit on the inside of the femur. If a muscle's on the inside of the bone, which way is it going to rotate the bone? Internally or externally?
Externally?
Internally. Yeah, let's do that again. If a muscle's on the inside of the bone, which way is it going to rotate the bone? Inside or outside?
Inside.
Inside. If a muscle attaches to the outside of the bone, like the tensor fascia lata, which way is it going to rotate the bone? Inside or outside?
Outside.
Outside. That's right. Exactly right. Okay, and here's the fibers of the iliacus, and they come down and they join, and right about here would be considered the iliopsoas muscle. Okay, I hope that you guys. I hope that's clear enough for you guys. The iliopsoas, and then the semimembranosus tendinosus and the hamstrings. If we're looking at the iliopsoas, iliacus, psoas, iliopsoas. If we're looking at the iliopsoas, what movement are we talking about? Are we talking about flexion, hip flexion, or hip extension?
Flexion?
Very good. Is it the same muscles moving when the foot is on the floor, like a closed chain, like a squat or deadlift, as it is when the foot is floating up off the floor, like running, which is open chain?
Open chain?
Is it the same muscles?
That's the same.
It's the
Yeah.
same muscles. Yes, it is. Yes, it is. And there's other muscles involved which do hip flexion. Can you guys name me a couple of those muscles, even just broadly?
Inflation. Look at the tensor fascia.
Yeah, tensor fascia lata, yes. But a broad statement would be something like the quadriceps.
Yeah.
Quadriceps muscles, right? And the quadriceps are made up of rectus femoris. Mute yourselves and repeat after me. Rectus femoris.
Rectus
Practice
femoris.
femoris.
Yeah, but mute yourselves because we're gonna do it 3 times. 3 times 4 is 12. It's rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, which is underneath the rectus femoris. So rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. Last time, rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis. There's also other muscles which are considered part of the hip flexor group. Tensor fascia lata can function in hip flexion, although for external and internal rotation, it's more powerful. So it assists, it's a synergist in hip flexion. Sartorius is considered a hip flexor muscle, as is the gracilis. I don't know if these are synergists, the gracilis and the sartorius, or if they're considered prime movers. I don't think they're prime movers, but anyway, the sartorius attaches on the iliac crest and then attaches to the inside of the tibia down below the knee. It attaches inside here on the medial side of the tibia, which means that when this muscle contracts, which way is the kneecap going to point? Is it going to point outside or inside?
Outside?
Very good. And outside is called external or internal rotation?
Would it be
External.
external?
External rotation, yes, excellent. You guys are sharp, and that's no lie. Okay, so we got a few more of those muscles now. Let's because we're like already looking in muscle and kind of muscle minded, let's take a look at the muscles of the back and of the shoulder, because those can be a little intimidating. Oftentimes when we look at the shoulder, we think only about the muscles on the back of the shoulder. In fact, there are lots of muscles that act on the shoulder, including the pectoralis muscle, the serratus muscle. You see the serratus, it's not one of the sits muscles, but it definitely acts on the shoulder. Sits muscles are the supraspinatus, infraspinatus, teres minor, and subscapularis. So say those with me, with your mute on, please. Supraspinatus, infraspinatus, teres minor, and subscapularis. Supraspinatus, infraspinatus, teres minor, and subscapularis. So if we look at the muscles of the posterior, it should be pretty obvious how those muscles function. If you can, we have to get oriented first to make sense of all this. It's kind of a mess when you first look at it, right? So here you have the spine of the scapula, and then this is the humerus. It's called the greater tubercle of the humerus. So a tubercle is a bump, right? And if we strip the muscles away, you can see like the tubercle much more clearly. Here's the humerus bone right here. Here's the bump. And then here is the spine of the scapula. Oh, my poor dog is so scared. Something scaring him. Okay, so we have the infraspinatus muscle, and then we have the teres minor muscle, infraspinatus, and then teres minor muscle. Teres major is down here. It's not considered one of the shoulder girdle muscles, but you can see clearly it attaches to the humerus. And we think of these muscles back here as being the shoulder girdle or sits muscles proper. And then the supraspinatus is up here. I'm sure I can find a larger picture for you guys. But before we look at the larger picture, I want to show you guys the muscles on the front. Yeah, so this is, I'm sorry, that's a little too abstract. So I'm looking for the subscapularis. Let me just pull one up here. So if you look at the body from the front, so here's the front, right? So the rib cage and sternum. Here's the clavicle. This is the spine of the scapula, under the clavicle, behind the clavicle. On the front surface is the subscapularis, and you can tell that it attaches to the more inside, more medial aspect of the humerus. So which way, Emmy, which way is the subscapularis going to rotate the humerus? Is it going to rotate it internally or externally?
It would be internally, right?
That's correct. And the majority of the muscles on the posterior aspect of the shoulder, they attach to the external portion of the humerus. So they would rotate the humerus which way? Externally or internally?
Externally.
Externally, that's right. That's right. Okay, you can mute yourself. Thank you very much. So there's a feature on the bone that I want to tell you guys about. And it's a little bit into the nitty gritty, right? And I don't know if they're going to ask you this or not, but if they say, you know, what muscles attach to the greater tubercle of the humerus, or what muscle is between the greater and the lesser tubercle of the humerus, and you don't know it, maybe you even freak out, like you panic a little bit, you definitely will miss the question, and you don't need to. You don't need to miss the question. So let's take a look at those features. So this is the shoulder with the scapula and the humerus. Everybody unmute yourself. Are we looking at this from the front or the back?
The back.
The
One more time.
The back.
It's from the front.
Right.
Is that you, Rosie, who said the back?
Yeah,
was-
it's at the back.
Okay.
Okay.
I
So,
also thought it was the back.
okay. So it's a little difficult to tell in like a two-dimensional drawing, but if you look at this bone here, this bone should hopefully look like it's in the front, right? That's the clavicle. And then if you look at this socket, oh, also this bone here looks like it's pointing to the front. Again, it's two-dimensional, it's a little hard, right? This looks more like a concave surface than a convex surface. So here's the front of the scapula, the anterior face of the scapula. And this joint here, the glenoid joint, should look like it's facing a little bit to the front. It kind of faces laterally and then about 30 degrees to the front.
Could you just briefly go over concave and convex?
Yes, absolutely. So if you look at the scapula,
Mhm. Okay.
concave means cave shaped, right? Like a cave, you go into something that's hollow, and convex is the opposite of a cave. So here's the front of the scapula. I can tell because here's the coracoid process that's pointing toward the front. And here's the spine of the scapula, which is on the back, right? If you look at the front of the scapula, can you see how there's a ridge, like a raised ridge? Ridges are raised and valleys are, what's the opposite of raised? Valleys are sunken, hollow. Can you see there's a ridge there?
Yeah.
And
Yeah.
then inside the ridge, there is a depression or like a very shallow valley or a cave, concave. And if you look at the back of the shoulder blade, there's also a ridge, but the surface overall is not strictly concave. I mean, nothing in the body is strictly anything. That it all travels in, like, there's no right angles, there's no straight lines. You know, it's all bendy and twisty and confusing. But the surface here is less concave, I would say, and more convex, because you have this big thing there pushing up, this big ridge here in the middle. You have sort of like two ridges, three if you count the spine, whatever. If you look at the front, it looks more convex than concave. It looks more concave than convex. They're not going to ask you which one is more concave, which one is more convex. That's not a question that they're going to ask, right? But just to get oriented, you look for the bones. Which one looks like it's pointing forward? This one's pointing forward. This one's pointing forward. This one's not. So this looks like the coracoid. I'm sorry, am I cutting someone off? Just speak out if you have something to add. And then this one is pointing forward-ish, right? We know this is the spine, so this must be the back of the scapular body. This is the front of the scapular body. You're not going to need to know the lateral angle, all these details, superior angle, superior border. You're not going to need to know all those. You'll need to know medial and lateral, superior, inferior. You need to know those. You'll need to know the coracoid process and the acromion and the scapular spine. The reason you have to know those really is because the acromion, because of the joints that they form and the muscles they attach to. You guys want me to take you through those now?
Okay. Yeah.
Can I hear more than one person? Yes? No? So the acromion, you can remember acromion because of the acromioclavicular joint. So the acromion attaches to the clavicle, and here it is. So here's the acromion, and here's the clavicle. Is this what feature is this right here?
The spine.
That's yes, very good, very good. You know, can I confide something in you? I just learned that. I just figured out supraspinatus, infraspinatus, like 2023. You know, raise your hand if you got your degree in 2020 in 2005. So anyhow, spine of the scapula. So this must be the posterior aspect. This is the medial portion. This is the lateral portion, inferior and superior. Okay, so clavicle, acromion, acromioclavicular joint, AC joint, acromioclavicular joint. On the coracoid process, from the coracoid process, you can, there's a muscle that attaches, it's called the coracobrachialis. Coracobrachialis. You may remember that, or you may not, but it's a muscle that is kind of synergist for the biceps, right? You can see that its origin is a thin, it has a small origin site. So it's not going to be a strong muscle, right? It's smaller bicep. It's one belly. The biceps is two bellies, but it attaches to the humerus. It's sort of a synergist for shoulder flexion. What plane is shoulder flexion in? Sagittal or frontal?
Frontal.
Frontal is coronal.
Frontal.
Frontal is coronal. If you abduct, you reach the corona. So is it frontal or sagittal?
Sagittal.
Sagittal. Yes, very good. Sagittal. So the coracoid process, the coracobrachialis, right? And then the glenoid cavity or glenoid fossa. Fossa is the same as cavity. The glenoid cavity or glenoid fossa can be remembered by the glenohumeral joint. So the glenohumeral joint, or the humeroglenoid joint, glenohumeral joint. Okay. How's everybody doing? Is everybody completely fried? You getting there? Can you
Get there.
can you hang for a little bit longer?
Yes.
Yes.
Okay, great. We'll take a break soon. I have no desire to wear you guys out. So if we're looking at the shoulder, now we're oriented, right? Here's the front of the scapula, anterior portion of the scapula, lateral border, medial border, inferior, superior, clavicle, acromion. What's the name of this joint? Acromion and clavicle. What's the name of that joint?
The clavicle?
Okay. No.
Acromion and clavicle.
And clavicle.
Acromioclavicular
Right.
joint. Perhaps I should write that down for you. I'm sorry, say again?
Yeah, that's
Yeah. Perhaps I should write that down for you. I'm just going to stick it down here. This is not organized, but I should stick it down here. AC joint, acromioclavicular, coracoid process, coracobrachialis muscle. Yeah, so you see the front of the shoulder, here's the humerus, and there are bumps on this thing, right? There's tubercles. So here's a smaller bump and a bigger bump, a smaller tubercle and a bigger tubercle. Lesser tubercle has a subscap muscle attaching to it, subscapularis. So the fibers go like this. This is the anterior portion, and it's slightly what? Internal or external? I'm sorry.
Internal?
It's slightly more medial or lateral, I should be saying. It's slightly more medial.
medium.
Medium.
Yes. And here, so the subscapularis attaches to the lesser tubercle, which is the medial aspect, and rotates the arm bone internally. The greater tubercle, the bigger bump, the greater tubercle, let's see if they have it. No, the greater tubercle has all the other sits muscles, the other three. So it has supraspinatus in the front. I'll find you. And then they have infraspinatus in the middle. And then they have, and then it's the, let me find this side view. Yeah. So now we have to get reoriented again. Okay, so we were looking at it from this angle. All right, we were standing right here, looking at the shoulder this way. The shoulder blade is back here. This is the back of the body. This is the front of the body. We were standing in the front. Now we're looking at it from the side. We're looking at the shoulder from the side. Imagine part of the shoulder blade back here. Right, so what we're seeing is the side and part of and kind of like the front. And here's the lesser tubercle, here's the greater tubercle. Does everyone know where we are now? Does anyone not know where we are? Please speak up if you're not oriented, if you don't know where we are. Because I will show you.
Okay,
You good?
yes,
Okay, excellent. So this is the front. Here's the subscapularis. This is the lesser tubercle. Here's the back. This is the greater tubercle. And you can see, and here's more posterior, right? So this is from the side and the front. This is from the side, a little bit more back. So say again. Okay, from the front to the back, the attachments are supraspinatus, infraspinatus, teres minor. Supraspinatus, infraspinatus, teres minor. And they all attach to the kind of the more lateral aspect. The subscapularis is the more medial. The supraspinatus, infraspinatus, and teres are more lateral attachments. So it should
So
make sense.
B is the back, is posterior.
This view is seeing the posterior.
Yeah.
And the back is the posterior. Yes. Did I answer? Was that your question? Is the back the posterior?
Yeah, I was
Yes.
just wondering if it was posterior. Okay.
okay.
Yes, the back is always the posterior. So the sits muscles, the three of them attach to the back, greater tubercle, to the back, the greater tubercle. And one of them attaches to the lesser tubercle, which is more in the front,
Okay.
more in the medial. In between the two of them, in between, there's a tendon, the biceps tendon. There's a bicipital groove. So in between them is the biceps. So if they ask you about these structures, the lesser and the greater tubercle, immediately I want you to draw up the three sits muscles on the greater tubercle, more on the back of the shoulder, and one muscle more on the front of the shoulder, and the biceps between them. And if you can just remember that, three on the back, one in the front, and the bigger tubercle, the greater tubercle is in the back, then you can navigate most of the rest of it. But if you can commit them to memory, I think a great way to actually, just need to see myself to do this. I think a great way to actually commit them to memory is to feel them on the shoulder. So you just find the groove in the kind of front side aspect where the biceps tendon attaches. It's not difficult to find. You can go like this. You can flex your biceps, and you'll feel the tendon moving a little bit. You have to actually lift your arm a little as you flex. My kid didn't make his bed. I'm glad you guys are seeing all that. All right, lift the arm a little bit, and you'll feel the biceps tendon moving a little bit. Okay, so now you have the biceps tendon. You have the bicipital groove, so you know where kind of the front, a little bit inside, is located. Just inside of that is the subscapularis. So if you move your finger just a little bit inside, and then you rotate internally, you should feel some muscle fibers starting to contract. It's better if you keep your arm down. Right, here's the biceps tendon. And now if you put three fingers away from on the outside, here's the biceps tendon, biceps groove. And you should feel right on the side, there's like a bony protrusion. Any of you guys ever like fallen on your shoulder or like got punched there? Got hit there?
Yes.
That's like right where you get hit, right? There's tendons there, right? There's tendons there. So you just put your fingers like that. Just go approximately, 3 fingers for 3 tendons. Remember, it's the other 3 of the sits muscles, right? And then you can rotate your arm externally. Do you feel those fibers starting to contract? If you don't feel them contract, put your arm against some kind of resistance. So a wall, I'm using my knee, and then press against that resistance, and they'll pop out into your finger. So I think that's like a really important way to do it. Also, you're going to be locating these things for other people. Clinically, keep in mind when somebody comes in and they've had shoulder pain for more than like, if it's acute and it's really bad, or if they've had it for more than a few weeks, the whole thing's going to be inflamed. You can't palpate the tendons and discern, okay, the problem is the supraspinatus, not the infraspinatus. Stuff's too close together in there. Talking about an area that big. But I hope that they don't, ask you all those, but if they do, I'll be so proud if you guys nail that. Okay, what other muscles do I want to take you guys through? Let's do the muscles of the spine after a break. I think you guys need a break. Okay, so if you watch this video, right now it's called MBLEx Kinesio 12 review, study this first. But I'll give you a link, so and I will change the name. But if you look at this video, it walks you through everything that I walked you through today, the anatomy of the shoulder. There are some questions from a test prep. There's muscles of the neck. We'll be going over the anterior and posterior triangles of the neck. That's a question that I've seen on the review sites. This is Hugo Prep. This questions on here from Hugo Prep. They're good questions. And then we also go through the pec minor. I talk very specifically and in depth about the pec minor and the pec major, probably more than you need. But if we start with more and then leave some things behind, that'll be more efficient than not including them or adding things in later. The serratus anterior, and then we get into all the things that we just discussed about different fiber directions. I talk about the muscles of the back, which we're going to do next time, and then all the stuff that we covered today about getting oriented on the shoulder and finding the greater and lesser tubercles, the muscles that attach to the posterior, the anterior, where's the biceps brachii, how to feel that on yourself, etc. Right, and I give you a few different views from a few different sources. One of them is from above the shoulder. Anyway, this is a good video, and I will give you the link for that. And please watch this video. So now we're going to move on to the cardiovascular system. In the study guide, if you look at the slides of the study guide or the study guide that's in your MBLEx folder, let me just open that so you know what it looks like. Okay, so here's our MBLEx folder. And if you organize things by name, you'll see FSMTB, e-study guide, pathology contraindications, kinesiology, anatomy, and physiology, right? And you can open it. And it looks like this, and then you just have to zoom in to make it clear. So if you look at it, there's anatomy, kinesiology, patho, benefits, client assessment, ethics, boundaries, right? And then it's organized by systems. So circulatory system, lymphatic system, muscular system, respiratory, etc. Yeah. So what we're going to cover today are the first like half of the circulatory system, right? The first 4 or 5 bullet points, and you're going to have to do the other 4 or 5 on your own. So we're going to cover the top 4 or 5, and you're going to have to do the rest on your own. And I'll prepare stuff for you for that. I want to remind you of the stuff you do not have to know. You do not have to know the minor blood vessels. So there's lots of them. They are the blood vessels that supply the heart, the smaller structures of the heart, like the individual blood vessels that feed the muscles of the heart. You're not going to have to know the names of the blood vessels and the capillaries that go to certain places in the brain or the shoulder or the eye. All the types of white blood cells, basophils, eosinophils, T cells, killer cells. You don't have to know those. The function of specific white blood cells like eosinophils and basophils, you don't have to know those. So you don't have to know that they exist. You don't have to know the function. identify the cascade of chemical reactions that allow blood to clot. So you don't have to know anything about clotting factor or anything else about clotting. You will have to know that, for example, that calcium plays a role in clotting, but calcium also plays a role in muscle contraction, nerve conductivity, and bone density. That's why something like calcium is important, because it's important to multiple systems, multiple body systems, multiple organ systems. Here's an example of a couple questions from the MBLEx that they give you, that the FSMTB gives you. Remember, the FSMTB is the one that makes and administers the MBLEx. The mineral in the body that is essential for the structure of bones, muscle contractions, and blood coagulation. Bones, muscle contraction, blood coagulation is calcium, potassium, sodium, or magnesium. If you have a reason you pick one, the answer is calcium. If there's a reason you picked a different ion, please unmute yourself and let me know. Or a different mineral, please unmute yourself now and let me know. So I would think maybe it's sodium, because sodium is so important in muscle contraction, and calcium is like second to that. But the question asks basically, what do all these systems have in common? Bones, muscles, blood. What do they have? Which one do they have in common? And the answer is calcium. Sodium is not that important for blood coagulation or for bones. It's only really important for muscles and for nerves. Okay, next one. Blood circulating to the lungs from the heart. To the lungs from the heart would pass through which of the following structures? The pulmonary artery, the left ventricle, the ascending aorta, or the left atrium? And the answer is the pulmonary artery.
Yeah.
Say again. And these will be clear today. We're going to go over these structures today. Okay. So what you need to know, what you're going to have to study on your own, what you don't need to know, this is all going to be in today's recording. Am I recording? Let me make sure I'm recording. Yes, I am recording. Okay, great. If you go to your MBLEx folder on the Google Drive, if you click on body systems, today's presentation is in that folder, cardiovascular circulatory. So MBLEx Drive, body systems, there it is right here. Not all of these are fleshed out yet. Organization is tough. It's tough. Okay, so when you see this symbol on my slides, it means that the study points are from the FSMTB. That's just to reassure you that this is like from the source that administers the exam. This is under the anatomy and physiology section of the exam by the FSMTB, and it's the circulatory system we're dealing today. When you see descriptions like system structure and system function, it's important. The reason is because the structure refers to anatomy and the function refers to the physiology. So you know right away what it is that you're going to have to learn today or be responsible for. Of the study points, one of them, right? Remember your study points for the circulatory system. We're going to go through 4 or 5 today. Of the study points, the first one is understand the various ways massage or body work might affect circulation. So broadly speaking, the way that massage affects circulation is that it increases systemic circulation. Systemic and local, those are terms that you want to know. Systemic means throughout the whole body or body-wide or general. And local means in the area where you're working, the area where you're applying pressure or applying the body work technique. It increases systemic circulation. Now, this happens as a result of a half an hour, 45-minute, hour-long, whatever, massage, and you're working on a pretty wide area of the body, like the whole back surface, or half of the back surface, half of the front surface, something like that. And in the process of working on a wide surface, you create some inflammation, which is good, and you push the circulation, which is good, and that has an effect on the rest of the body. It temporarily increases circulation. increases systemic circulation. Almost all the techs, almost all the techniques, all the hand techniques, they cause temporary or mechanical ischemia. Isch means to suppress or to stop or to slow down. And emia means blood. So they temporarily, the hand techniques temporarily cause ischemia. Let's take like just pressure, direct pressure, right? What we call in shiatsu, finger pressure, right? So just take finger pressure down on a tight wrist flexor muscle. It should make sense to you that pressing on that area occludes or temporarily stops or slows down the blood circulation where you're pressing. That's called ischemia. So ischemia is to suppress the blood or slowing down or lack of blood flow. Hyperemia happens after ischemia. So you press to call, and that causes ischemia. You let go, the blood flow opens, the circulation opens, and as a result, there's hyperemia. A large amount of blood floods in. Just like if you stepped on a garden hose, the water slows down, and then if you take your foot off, the water comes through with greater force, greater volume than if it had been unoccluded, allowed to flow normally. Let me know if that doesn't make sense to you, that when you apply a hand technique, the majority of hand techniques, whether it's petrissage or effleurage or Swedish gymnastics or whatever, most of the vast majority of the hand techniques first cause ischemia, and after that, they cause hyperemia. They first cause occlusion or suppression of blood, and then they cause a large amount of blood. And system-wide, that results in an increase in circulation temporarily. So if they ask you, how does massage affect circulation? What would you say, Khalees?
I was, excuse me, I would say it increased the circulation.
Great. And if they say, what is the mechanical? Mechanical means the first effect while you're pressing. We'll go over that again. If they say, what's the mechanical effect of X technique, petrissage, what would you say? While you're pressing, the first effect.
It slows down.
The ischemia.
I'm sorry, one more time.
Is it still on me or is it somebody else?
You, Khalees, please. When
Is
you
it
press
mechanical ischemia?
ischemia, yes, very good.
Okay.
Ischemia, yeah. And what does isch mean? Isch?
Suppressed
To suppress, and emia.
is the blood flow.
Yes, thank you. Okay, so moving on to the second study point. You're going to have to understand the different blood vessels, like arteries and capillaries, and the functions of these blood vessels. So they're giving you like a broad and not a very, very well coordinated statement, right? They're not being specific enough. I want you to remember that the flow of blood goes from the artery, which begins with the aorta, and it goes into the veins, which ends with the vena cava. And we're going to look at those structures, the vena cava and the aorta. But if you can remember, please mute yourselves and repeat after me. If you can remember and practice and remember aorta to artery, then the blood goes from the artery to the arteriole, and then into the capillary, the venule, then to the vein, then the vena cava. This is a great mnemonic, or not a mnemonic, a great thing for you to memorize. Aorta, artery, arteriole, capillary, venule, vein, vena cava. One more time. Aorta, artery, arteriole, capillary, venule, vein, vena cava. That's definitely something that I would ask that you practice on a regular basis, like daily. So we'll practice that in our class. Actually, let me put this up here in the basics. And let's learn, that's the order of the blood flow. So let's learn a little bit more about these. So the arteries, the aorta is the largest artery in the body. Arteries carry blood away from the heart, artery, away, letter A. And the veins carry blood towards the heart. With the exception of the pulmonary blood vessels, so that's the vessels are arteries and veins. With the exception of the vessels that go to the lungs, the pulma, arteries carry oxygen and blood, oxygenated blood to the whole body, and veins carry deoxygenated blood. With the lungs, it's the other way around. The arteries carry deoxygenated blood away from the heart to the lungs, and the blood picks up oxygen, and the pulmonary veins carry oxygenated blood from the lungs back into the heart. The veins carry oxygenated blood to the heart from the lungs. So with the lungs, it's reversed. Arteries carry oxygenated blood throughout the body. Veins carry deoxygenated blood from the body back to the heart. Arteries have thicker walls and they have muscular tissue that contracts. That's part of why you can feel a pulse at this artery down here. What's the name of this bone? This is the radius. So this is the radial artery. Up here you have the jugular artery. You have the inguinal artery next to the hip flexors. And then you have the artery of the dorsal pedis. I forget what it's called, but ped means foot and dorsal means dorsum of the foot, on the foot. I forget what, actually, let me not confuse you. Artery, dorsalis pedis. Yeah, let's see, what is this artery commonly called? The dorsalis pedis artery, dorsalis pedis. So dorsalis, from dorsal, back of the foot, pedis, ped meaning foot. Oh, my dog wants to go play with the other dog. All right. Veins have thinner walls. Veins have thinner walls and use valves to keep blood flowing. So they have to pass through valves in the veins in order for the blood to keep moving. The veins open and the valves open and close. And the valves also have a directionality to them. So they're kind of like funnels, and these funnels encourage the blood to move. Veins are blood vessels located throughout your body that collect oxygen for blood and return it to your heart. That's the same as saying veins carry deoxygenated blood. Arteries, also vessels. Arteries are blood vessels that play a critical part of your cardiovascular system. They are the blood vessels that distribute oxygen-rich blood to your entire body. I'm going to take this out. Arteries are blood vessels that distribute oxygen-rich blood to your entire body. Okay, and that covers that study point. You guys will get used to this format. All right, so I won't have to keep telling you. You'll just have it in your mind that this is another study point that we're doing now, right? So this study point was understanding the different blood vessels, such as arteries and capillaries, and the functions of the blood vessels. The arteries carry oxygenated blood. The veins carry deoxygenated blood. The arteries are thicker and have muscles. The veins are thinner and have valves. The order of the blood flow is aorta, artery, arterial, capillary, venule, vein, and vena cava. Every time I say something that I've asked you to repeat before, I hope you remember to repeat it along with me, even if you're flubbing it and getting it wrong. So let's get into the flow of blood out of the heart toward the lung and into the body and back. There's 2 slides for this. So the first is just stating the learning objective or the study point, and that's to comprehend what occurs in the various larger structures of the heart, such as the valves and the different heart chambers, right? So what we're going to look at is the heart and the larger structures. And here's a small graphic of the heart and the heart and the lungs and the larger structures. And on the next page are the larger pictures. I may need to enlarge this for you guys. If I do, of course, it's no problem. But I want you guys to go through this every day. I want you guys to go through this blood flow on the right and the left side of the heart every day because it's summarized very nicely. In fact, I think I put it in your MBLEx daily. Yeah, here it is. So you can when you look at this, you can enlarge it, you can blow it up, and that'll make it crystal clear. Okay, so we have, first thing you do is to get oriented, right? You always get oriented. Are we looking at the heart from the front or the back? Well, it says right here, look for whatever they give you. R is right. And R is right, is that right? Yeah, R is right. And then where's L's? They don't have L's. I took a L. They don't have L's labeled over here. They have it labeled on this other one. Okay, so you have right and left. Okay, if this is the right, my right hand is over here, my left hand is over here. This is literally how my process, how I do it every time. So I must be looking at it from the front. This is right, this is left, this is right, this is left. Okay, I got it now. This is the front of the heart. I know that S is superior and I is inferior. This is the top, this is the bottom. All right, so now I know that this is the top of the heart, this is the bottom of the heart. So on the right side, it goes from the SCV, ICV, that's superior vena cava, inferior vena cava, superior vena cava, inferior vena cava. I'm paranoid, so I'm going to make sure I'm recording, still recording. Superior vena cava, inferior vena cava, into the right atrium. So superior vena cava, that's the body's biggest vein. Inferior vena cava is also the body's biggest vein. There's two branches, the superior and the inferior. Guess why there are two branches, a superior and inferior? Emmy.
One's pumping out and one's pumping in.
That is an excellent guess, however, not accurate.
Okay, I don't know that.
They're both pumping into the heart, right? They're both pumping into the heart. So can you see me?
Yes.
Okay, so my heart is here, right?
Mhm.
And above my heart is a portion of the body, and below my heart is a portion of the body.
Yeah.
So now, why is there superior and inferior vena cava?
For the upper half and the lower half.
That's right. The superior brings in blood from the, humor me please.
The top half of the body.
Yes, thank you. And,
Yeah, to the superior and inferior part.
and
of
the
body.
inferior brings in blood from the
Lower part of the body.
inferior portion. Correct, correct. You're not off the hook yet, Emmy. Atrium is shaped like letter A, like a ceiling, like a roof. So the atrium is on top. Superior vena cava, inferior vena cava into the right atrium. Through the tricuspid valve, we'll look at the valves again, into the right ventricle, from the atrium to the ventricle. From the atrium, go like this with your hands. I can't see you, nobody can see you. Go like this with your hands, the right atrium into the ventricle. So the atrium is on top, the ventricle, the valley is on bottom. Atrium on top, ventricle on the bottom. Okay, you can, so which one is on top? The atrium or the ventricle?
The
And which one is
atrium
on,
and the ventricle.
and which one is on top, on bottom?
Ventricle.
The ventricle, good. What's the name of the valve between them?
Atrium and ventricle.
Right here on the screen.
Tricuspid.
Tricuspid valve. That's right.
Okay.
That's
Yeah.
right.
Okay.
It's blue. Do you think this is oxygenated or deoxygenated?
Deoxygenated.
Does it make sense to you that deoxygenated blood would be coming from the top and bottom of the body into the heart?
Yes.
Why?
Because it has to go through the heart to get oxygenated.
Yeah, it has to go through the heart to get oxygenated by the lungs. And also, Emmy, because once it's nourished the tissues in the top and the bottom of the body's done with it. It's got to be recycled, reoxygenated. It has to cycle through the circulation to be reoxygenated. Okay, you can mute yourself. Thank you very much. Then after it's in the right ventricle, it has to go through the pulmonary, pulma means lung, pulma means lung. It has to go through the pulmonary artery away from the heart to the lungs. After it's in the right ventricle, it goes through the pulmonary artery away from the heart, artery away, and into the lungs. Deoxygenated blood goes to the lungs, it picks up oxygen, and it is returned through the veins, the pulmonary veins, into the left chamber of the heart. So the right side carries, just say to yourself, stay muted, but the right side carries what? Deoxygenated or oxygenated blood? Deoxygenated blood. The left side carries what? Oxygenated or deoxygenated blood? Oxygenated blood. They may ask you something like that, right? Which one carries deoxygenated? Which one receives oxygenated blood, or which one pumps out oxygenated blood to the body? So one more time for the right side, and then we'll move on to the left. Deoxygenated blood comes in through the superior vena cava and the inferior vena cava. They both feed into the right atrium, which is on the top chamber on the right side of the heart, right deoxygenated top side atrium. From the atrium, the deoxygenated blood goes into the right ventricle. To get to the right ventricle from the atrium, to get there, it has to go through a valve. The name of that valve is the tricuspid valve. Tricuspid valve. Once it's in the right ventricle, it gets pumped out into the pulmonary artery. To get from the ventricle to the artery, it goes through the pulmonary valve. The valve is named for the pulmonary artery. It goes through the pulmonary artery and it goes out into the lungs, the left lung and the right lung. The blood gets oxygenated and returns through the pulmonary veins. Now it comes back in through the pulmonary veins into the left atrium. It doesn't show it very well on this diagram. It shows it very well on this diagram. You see? Or well enough. From the lungs through the pulmonary veins into the left atrium, fresh red oxygenated blood. From the left atrium into the left ventricle, and it's got to pass through the mitral valve. This is also called the bicuspid valve, mitral or bicuspid. Tricuspid on the right, bicuspid on the left. Bicuspid is also called the mitral valve. Left ventricle is on the bottom, atrium on top, ventricle on the bottom, atrium on top, ventricle on the bottom. The left ventricle receives the blood and pumps it out into the aorta. To get into the aorta, it's got to go through the aortic valve. Left ventricle, aortic valve, aorta. The aortic valve is named after the aorta. From the aorta, one more time, please.
The right is, I have a question.
Yes.
The right is oxygenated, right?
The right side of the heart receives deoxygenated blood.
Okay, I'm just confused because we were saying left is deoxygenated and then right is oxygenated, but then on the diagram,
That's what I
right
said.
Yeah,
that is incorrect. No, that's definitely not correct. No, thank you. The right side is deoxygenated.
okay.
The left side is oxygenated. You know, please stop me if you are confused, because it means either I'm switching something, or it means you don't understand it.
So that is correct then. The right is deoxygenated and then the left.
The right side is deoxygenated, the left side is oxygenated. Can you hear and see how carefully I have to think about it?
Yeah.
To be accurate, that's the level of energy you have to put into it. The right side is deoxygenated, the left side is oxygenated.
Okay, that makes more sense. Thank you.
Yeah, I'm sorry. So left ventricle, oxygenated blood into the aorta, which pumps it to the rest of the body, the upper part and the lower part, and out through the limbs, the aorta. Okay, we see a clearer picture of the aorta here, and you can see that there's branches that go up. There's arteries that come off of the aorta that go up, and there's a branch of the aorta that goes down into the trunk and the lower body, and that descending part of the aorta has arteries that'll come off of it there. Okay. If you go to the presentation, you'll also see this. Oops. You'll also see this graphic of the heart. I'm sorry, the controls are a little challenging for me sometimes. Okay, so you see this graphic of the heart. I hope this is big enough for you. And you see the valves. And I just wanted to show you guys the valves, because you can see, if you look closely, I'm sorry. You can see, if you look closely, the tricuspid valve has like 3 sections in there. It's kind of like a peace symbol, like a circle with 3 lines, a line that branches off into to make 3 lines. So it's 3 sections. The tricuspid, the bicuspid has one line across it, one opening. So there's 2 flaps. There's 3 flaps in the tricuspid, 2 flaps in the bicuspid, aka mitral valve. And you have these sinews or tendons. They're not going to ask you about those. You have these sinews or tendons in the heart that hold the valves to muscles that pull the valves open and relax to allow the valves to close. Okay, you won't be asked about the sinews. So next, the final learning objective or final study point that we're going to do for today is to comprehend what occurs in the various larger structures of the heart, such as we just did that. We just did what occurs in the larger structures of the heart, such as the valves and the different heart chambers. Now we have to identify the basic categories of the components of blood and the function of these components. This is poorly worded. What does that mean? Categories of the components. So we have to learn the different parts of the blood. All right, there's 5 parts of the blood, and we have to learn the categories of those. All right, so here's the 5 parts of the blood. Those are plasma, red blood cells, platelets, white blood cells, and hemoglobin. Plasma, red blood cells, platelets, white blood cells, and hemoglobin. So plasma is the water. It's the fluid of the blood. It's the main part of the blood. It's 55%. 55% of the blood is plasma. Whole blood contains red cells, white cells, platelets, suspended in blood plasma. Plasma is 55% of volume. This sentence here leaves out hemoglobin. So plasma is the main component of the blood, consists mostly of water. There's stuff in the water. It's not just pure water. There's proteins in there. There's gases, ions, nutrients. There's also waste. Nutrients can be things like sugar. Sugar, unprocessed carbohydrates. They may be proteins or pieces of proteins, amino acids. They may be oxygen. Waste can be things like dead cells, dead red blood cells, broken pieces of structures that are on their way to, the lymphatic system or wherever. They can be destroyed pathogens like dead bacteria or parts of viruses that have been destroyed. They can be other kinds of wastes. They can be gases. So plasma is a plasma is a solution. Plasma is a solution. Water is a solvent. And all these proteins, ions, nutrients, and wastes and stuff in there, those are the solutes. We will look at that again in the future. So red blood cells are also in there. Red blood cells, this is what we think of as the blood. Red blood cells are also called erythrocytes. Erythro means red. White blood cells are leukocytes. Leuko means white. Leukocytes are white blood cells. Erythrocytes are red blood cells. Erythro means red. Cyte means cell. Leuko means white. Cyte means cell. Erythro, red, cyte, cell. Red blood cells, they're the ones that carry oxygen. They also carry carbon dioxide. Did you know that? I didn't know that. Red blood cells carry oxygen and carbon dioxide. That's the function of red blood cells. They definitely want you to know that, or to base your answering of questions on that foundational piece of knowledge. Platelets. Platelets are also in there. They're responsible for blood clotting. You don't have to know how platelets work. Clotting factors, any of that. Vitamins. You don't have to know any of that. You just have to know that platelets are the ones that do blood clotting. Low platelet count means someone can't clot as well. Low platelet count can result from conditions such as anemia, or it can result from medications like blood thinners. Warfarin or Coumadin, they're called blood thinners. We'll be going over those. White blood cells, the fourth part, leukocytes, they're part of the immune system. Obviously, they function in the immune response. Their job is to mitigate or to do immunity, to function immunity. And then there's hemoglobin, which is the protein that contributes the red color to blood, and it carries the oxygen. Hemoglobin carries the oxygen. I believe hemoglobin is built by iron, using iron, and iron is red in color. This is just a graphic showing red blood cells going through a vessel. Remember, vessels can be arteries, veins, arteries, arterioles, capillaries. Does anyone have any questions about plasma, red blood cells, platelets, white blood cells, or hemoglobin? These are the basic components of the blood and the
I have a
functions.
question.
Yes.
For the white blood cells, do we need to know anything about like infection?
Well, you would have to know how the white blood cells function. And I think you do. So broadly, if you look at the slide, I'm circling it, broadly, what is the function of white blood cells?
For the immune system.
For the immune system, yeah. They function in the immune response. They're part of the immune system. So if there's an infection, what is the job of the white blood cells, broadly speaking?
To fight it off?
To fight it off, or to use the terms like immune system or immune response or function. To what?
Would it be to like let the immune system know?
The white blood cells are part of the immune system. So you could say, using the words response and immune, you could say to begin an immune response, or to get the immune system to respond, or to respond with immunity. Or you could say to fight the infection, as long as you know that that means an immune response.
Okay, I understand now.
Yeah, good. I just wanted to prompt you to start using the actual terms, right? Because that's not part of our active vocabulary. We don't speak that way every day. How much more do we have? Okay. We're out of time. Please read the next two slides on external and internal respiration, and let me know next time if you have any questions. This time for this one, because it's pretty simple, you can let me know in the text message thread if you don't understand external and internal respiration. Okay. More slides will be added to this presentation to cover the other study points that are in the circulatory system. And once we go through enough of these systems and enough of the sections are anatomy, kinesiology, patho, etc. Once we go through enough of these, then we'll start doing some questions from the practice exam websites. All right, guys?
All right.
Okay,
All right. So have a great week.
you too.
Thank you.
I'll see you next week, Saturday at 11 o'clock Eastern time.
All right. Thank you.
All right.
Okay.